everyone, welcome to Bold Faces, an initiative of Smart City Consult, which is a subsidiary of Smart City Mall Africa. My name is Joshua Oshowo. I'm a proud host, and I'm happy to share amazing things with you about smart cities in Africa with top consultants in this space. Thank you and welcome. All right, so today I'll be having a short interview with an amazing guest who is a top health tech founder, which we call Smart Health Systems, ensuring life is easy across Africa through the health space. His name is Mr. Kenneth. He's a consultant with Smart City Consults and designs master plans for smart cities across the world to engage proper health tech solutions and health tech systems. And thank you for watching. Please ensure you share this video with your few friends across the world. Let them know that they're about to learn about what smart health can do for their lives, for their businesses, and for their nations. Thank you, and thank you very much. All right. Good to have you, Mr. Kenneth.
Thank you very much.
Thanks again for coming. I say you look like an ambassador of smart health right now.
Oh, definitely.
Right. Tell us about you.
Okay, so thank you once again for having me, Joshua. It's a privilege and a pleasure to be here. My name is Kenneth. I am the CEO of Hella Limited. We provide services for hospitals and clinics by providing electronic medical records solutions and enterprise resource planning solutions as well. This helps hospitals and clinics to manage their patients' data and records, and also to manage their day-to-day operational services and works all throughout. And I'm very, very much passionate about the healthcare industry and revolutionizing healthcare data across Africa. Thank you.
Amazing. I love the sound, right? And I know there's a lot that Africa needs to hear from you, needs to see your works, right? Like I always tell people, city developers across Africa, right? You need to ensure that if you promise people that you want to develop a tech city, a metropolis, a smart city, you need to have all technologies in the foundational structure, the blueprints and master plan of your city. Else, you only try to build upon what was not existing, right? Oh, amazing. So I have some questions for Mr. Kenneth, right? Because you are the one on the hot seat right now. And I want to know, what's your vision for the smart health space in smart cities in general?
That's a wonderful question. So in the smart health space, of course, let's simplify it. Healthcare is something that's very, very important across every smart city. In fact, scratch that, across every city. But now applying smart tech to healthcare is basically about extracting real-time data, readily available clinical data to save lives. And if you don't do this, everything perishes. So any city that can effectively hold or house real-time accessible data for the patients to be able to render quick, effective, and efficient healthcare services has won that city. That city is complete when it comes to health tech, in summary.
Amazing. So if you go redesign, because we already have cities in Africa, right? It was shocking to my research, right? Only a few platforms have that research, that there are approximately 12,500 cities in Africa. But the data of the world says there are 11 cities in Africa. Right, looking at when I looked at the data and I compiled them, and I said even what we call towns in a particular nation is what another person calls a city in the Western world. Right, the only difference is the education of the people, right, and the technologies that have been built into the system in that town. Then you call it a city.
Interesting.
Right. So if you could redesign Africa's infrastructure, what would you put from scratch with regards to healthcare?
Thank you for that. Keyword is interoperability. Interoperability in the sense that in any aspect of the city that you live in, the moment a citizen moves from point A to point B, his health data is transferred from the clinician who is seeing him over there at point A to the point B clinician. That readily available data and accessibility of healthcare data is essential to help healthcare professionals to be able to access care and render care to patients. Take, for example, if I'm to innovate anything afresh, I would, from scratch, build data systems and data sets, data managers across smart cities, such that the moment a citizen now comes in, his records through consent are easily transferable. Take, for example, I'm wearing a smartwatch that manages and regulates all my health data. If through the smartwatch, anywhere I go, I can transfer my heart rate, or I can easily hand it over to my clinician to see some vital data about my health, that saves the doctor a lot of problems, because that gap is currently what we're facing here in Africa. Thank you.
I don't just want to go into that area because I'm buzzing after a lot of information and a lot of challenges that health systems transferring of health data from different hospitals to different doctors to different Japa doctors, is common to African parlance across the world, where the healthcare, we call them the patients,
yes.
Right? The patients face a challenge. Now, when a doctor leaves a particular location, the information and the care they need also disappears from the building.
Precisely.
Right. So now let's look at that area of AI. Right. AI, Internet of Things, IoT, right, robotics. Right. And look at how has it transformed, because you call it smart tech. How has it transformed healthcare so far?
Well, I would say the brilliance of AI and Internet of Things particularly has been very revolutionary. Take, for example, someone just mentioned to me the BMI machine just now, and even scanning tools that automatically detect through big data, detects patterns and detects so many ailments in the body. Everything is geared towards aiding and assisting the clinician to be able to diagnose and effectively treat or render care to patients. And I believe if we integrated this into smart homes, this would be really, really, amazing for smart cities and smart homes. I mean, if it penetrates the real estate industry, it's a game changer.
Very, very, very true. If you are a developer, an agent, a stakeholder in the real estate industry, a town planner, please, that information is for you. Collaborate with the health tech industry and you will have a bigger sale. Now, let's go on to the area of human impact, because you just mentioned the real estate space, and there's no real estate without human beings. Right? So now, how do we avoid? Because you mentioned a smartwatch, and I know that a smartwatch is minimum, averagely $30 to $100 average, right? For a smartwatch, depending on the class that you buy and the grade that you buy and the functionalities involved, right? So how do we ensure that this health tech does not widen the gap between the urban rich and the rural poor? You might need to talk about that.
Okay, so this is excellent. Now, I'm one who believes in cutting your coat according to your size, right?
Wearing a coat.
Precisely.
All right.
And the fancy one at that.
Thank you.
So, once you cannot afford things like a smartwatch or or a smartphone, for example, there are infrastructures that can be put in place in various healthcare facilities, various healthcare cities, various smart cities, such that if we accommodate data, readily available data, for patients who are with a smartwatch, that it can be transferable to any doctor or physician you're seeing from the smartwatch, fine and good. If it's not from a smartwatch, it can be from a smartphone. If it's not from a smartphone, it can be as easy as dialing a USSD code. Even a touchlight phone, Nokia 3310, should be able to do that. A USSD code, and your information should be sent to you via text, and then you hand it over to your physician. The key thing is, like I keep saying, readily available data that would save lives when it matters.
Amazing, and that's really a big point. I don't know who will take this idea and run with it, but one thing I know is that ideas need people to run with them, right? And if you are hearing this podcast anywhere across the world, it's not about penetrating people that have the devices already, that are the best, right? It's just like having a smart passport, right? That you can easily scan. That's one way. If you only can give USD codes to every health issue or complaint or data set, right? You could help a lot of people from their phones send signals to the clinician that you mentioned, and in time. I can imagine having a what I call a sheet or like a wallpaper inside every school, inside every church, inside every mosque, having the codes, health codes for people to click in and type in on their phones when they need to report anything urgently. Then that will really reduce stress for the limited clinicians that we have in Africa. So we certainly need to work with that. Please run with that, and please reach out to us and on any collaboration that you might need. Now, you have spoken about technology. We don't need to talk about much about that. You can reach out to consultant Kenneth on any information. He's on LinkedIn, on social media platforms. Reach out to him to consult with him in that area of health. Now, there's another question I have for you, right? And that's about the future of work. I remember the first day I heard about this statement. That was approximately 2009. It was future of work, and then they started imagining what will happen. But right now we are in it. Right? This 16 years after, and we are currently in it.
Of course.
Right? And we are saying, oh, people working inside physical locations or via remote. But now you need to ask that question, we are there.
Thank you.
Right? So what advice will you give to young Africans who are passionate about merging the healthcare and the tech industry together?
So thank you very much. You hit a very brilliant point, which I have been very eager to talk about.
Okay.
Right. So to be honest with you, these days, you don't really need to have a hospital with physical borders or physical walls. Do you get? With the emergence of, say, telehealth, a qualified, registered, emphasis on qualified and registered physician who has been approved, of course, can register on, telehealth apps and speak directly to patients and also earn. I mean, one since we're also talking about, the tech industry and smart cities, one very, very interesting and important thing here is if a real estate company devises a city now, you don't necessarily have to spend so much building a very large, massive hospital. You can have a small clinic that accommodates one or two or several patients. But in the individual homes, you can bring the doctors to your patients. And how can you do that? Just by communicating to them via a smart device. Now you're also providing employment to young doctors, upcoming graduates who are just qualified and willing to, they still have that zeal and willing to pour their knowledge and, save lives. And you also have patients, on the other hand, who can receive care from the comfort of their home. Take, for example, people like flying doctors, Doctors Without Borders. These are people who are doing great and credible things across Africa currently, just to mention a few. And I believe that's where the future is heading towards. It's heading towards that point whereby globally we can consult and interact and receive treatment, receive care. And with the tools on ground, I'm sorry I have to mention technology, but with the tools on ground, a doctor could just say, okay, apply this smart tool to either measure your BMI, measure your vitals, measure anything. Even take blood work. There are now tools that take blood work and you can transmit it via email to whoever you wish to transmit it to. And investigation can be carried out over there, without the doctor ever physically coming to see you or you physically going to visit the doctor. As simple as that.
One thing you can trust this podcast for is that you can regularly get informative, what I call it, verifiable information and ideas that you can use to run, right? Highlighting why I mention Smart City Consult regularly is because he's a consult member. I lead Smart City Consult in Africa, right? And there are so many things that Africa needs to latch on that we need more people to execute. So if you're executing any of those kind of things, please reach out to us, consult@smartcitymall.africa, and then we reach out to you. Now, he mentioned something, and I now looked at that the way we have automated the logistics space.
Yes.
Where we have drivers, we have owner of platforms, we have owner of the vehicles, we have the customers, and we have the technicians that repair the vehicles, giving everybody businesses. It's the same way. Now I'm hearing that we have doctors, right? We have people that could accredit them. We have healthcare personnel who know the basics, right? We now need the IoT devices that will be in the buildings, the people that will build the buildings,
exactly,
right? And then the verified, what I call them, health tech vendors, who will be instantly hinted from the phone of the person that had the device, that had the issue, the patient, I need this care now. Someone has that equipment in their house that is not using it, that can instantly, because it's verified, go to that patient's place, get that signal, and go to where there's network, if there's network in that location, to send it to the clinician.
Precisely.
And make life easy, because it's not everybody that has the finance to buy a vehicle. But some people have the vehicle, they're not using it for anything.
Of course.
Right? That could have made life very easy. And that will now bring a section which I was already answering under a section of the area of future of work, is where do people, what kind of jobs and skills will come out, right, as health tech integrates to smart cities.
Okay, thank you. So, I mean, to start with, smart cities are a holistic ecosystem for every aspect of life, because it provides jobs for everyone in every aspect. Now, for the health tech aspect, it is almost, it's as far as the mind can conceive. First, you're talking about the physicians themselves. you can build your own business brand, your own name as a physician, as a doctor, as a lab scientist, by providing these services directly. And you can build your credibility. Think of this innovation by Uvah. Uvah gives you the ability to manage your own time. Right now, doctors are having brain drain because they have, more than, I won't call it a 9 to 5, morning till the next day, kind of working in the hospital. But if you had your time and you say, okay, I'm ready to log into this app and treat as many people, save as many people as I can, because I am passionate about saving lives. And then now I want to pull out of this app, log out, and focus on other things, my family, my own health as well, and other loved ones, other things. You can see how this helps. Now, also talking about, even the transportation aspect. There are people who would dispatch, who can deliver items like samples, blood work, stool samples, urine samples. That provides that easily with the convenience of these kind of solutions. Why? Because now you're no longer having to physically go to a hospital, physically go to a laboratory and all of that. Even down to x-ray scans and so on and so forth. It provides a market for all these equipment to be readily available and sold to buyers and people who can afford this. Now, I know this may seem like it targets only the niche of the elite, but like I said, you cut your coat according to your size, and we can find a system that works for each tier or each level of the financial ecosystem. So I believe that's something that is expansive and it's endless, as far and as wide as the mind can conceive. Thank you.
I still had a lot of questions, but it seems as if you have covered a lot of questions, right? Now let's have a decoy here.
Right.
I've heard of a few smart cities. Mm-hmm. There are about 5 different grades of smart cities.
Yeah.
But this is not a tutorial class. Right. So one question I want to ask you, because every expert grades things according to the lens of their bias.
Yes.
And the lens of their skill.
Of course.
So when you look at a smart city, as it said, I call no brands here. Right, you didn't pay me for that. Can a smart city exist without a smart healthcare system?
The answer is, short answer, quite simply no. Because as far as there's life, there is health. As far as there's health, there must be life. And the sustainability of that life is where health services and health tech comes into play a major role. So absolutely not. Just a short answer is no.
Beautiful. Now, I think you've answered this question, but is there anything you want to say about this? How do you see healthcare integrating with smart cities in Africa? Because we are really concerned about Africa.
Yeah.
Sorry for the bias. You're all right. You're concerned about Africa. How do you see health tech integrating with smart cities in Africa, where every system, like you mentioned, interoperability, right, from energy to transport, right, are interconnected?
Thank you very much. Once again, I would say I apologize for going ahead of myself for answering more than what I was asked. But yes, absolutely, you called it out, interoperability. And let me touch on something before I go a little further on that. Apologies for the bias, but why we're focused on Africa? Because our sister countries in other continents happen to have already bridged this gap.
A lot of gaps, yeah.
Yeah, and they've solved a lot of problems, which we can learn from and bring them here and innovate based on our own unique challenges here in Africa. Now, the key word is interoperability. Not many countries have achieved this, and I can say the United Kingdoms, they've significantly gone far. India, Pakistan, I believe, and a few others. Nigeria is actually trying to achieve this currently through the Nigerian Digital Health Initiative. I met with the coordinator.
So can you mention that again louder?
Okay, the Nigerian Digital Health Initiative, NDHI. I met with the coordinator, a very brilliant guy. They've gathered all stakeholders, including myself, to speak on this and what we are trying to do right now, which brings me back to your initial question about if we were to reset the infrastructure of the smart cities in Africa, what would we do differently? Is to have a central interoperable system whereby healthcare is accessible, healthcare data is easily accessible across every aspect of Africa. Meaning that if I, Kenneth, currently in Abuja, moves to Lagos, I can still access care with my physician who's still in Abuja. And if I, for any reason, maybe an emergency or whatsoever, needs to access care from someone in Lagos now, he can easily draw data from my central repository healthcare data system and see every detail about me and be able to render care effectively. Once we have this interoperable system that works across Africa, it's good. We're all good. And once we have cities implementing these individually in the smart city ecosystem, we can plug in, even though the data is in silos, we can plug into them.
To eat that question again,
yes,
right? We're speaking about how you see LTech fitting into the smart cities of Africa, right? We mentioned in terms of interoperability, right? And ensuring that they are connected, right?
Yes.
Transport to energy, real estate development and all the likes. There's even one thing before you even drop that point that I was saying that if the real estate development space can partner with the LTech space, then we will not struggle with seeing infrastructures who are not prepared for LTech spaces.
Exactly.
Handling LTech facilities.
Thank you.
Right? Because one thing everyone will pay for is how they can stop the breakdown of their body urgently.
Absolutely.
No matter the costs. Even if it's a future cost, and they will pay with their working life.
Preventive measures.
Right? So let's look at that as developers across Africa, and let's hear what the consultant will say next.
So I think I couldn't have even said it better, because you just hit the nail on the head. Yeah, but absolutely. The first thing is preventive measures. I mean, having people, having patients, having citizens have access to their own data first and foremost through tech devices, tech solutions. Having these things available in your homes, in your vicinity, in your facilities, having them available is the first step, because you as the individual have you first and foremost have the responsibility to take care of your own health. Now, having them accessible to the physicians is also very essential, because you as the physician need this to come to a very quick decision. If not, you might lose a life. So all of this is something that's very essential. And like you said, it's so expansive, because healthcare is something that everyone must pay attention to at one point in time. whether you're rich, whether you're poor, doesn't matter. If you're focusing on something else, the moment your health is down, everything stops. Life pauses, and you focus on that.
Amazing. So you're wrapping up already. Right. And I want to enter personally into your space.
Right.
Now, asking you a question.
Shoot.
I have background information about you, but the audience doesn't. Right. So I want to ask you a question. What inspired you personally to enter into the health tech space and give it a passion? I remember the bold faces celebration post I made about you.
Yeah.
And people would say,
thank you for that.
Oh, he's a visionary, is that. And I was wondering, like, I never knew who I have beside me.
Yeah.
So tell us about what inspired you personally into the health tech space.
Okay, so thank you very much. My initial inspiration was focused on tech. I was mostly passionate about tech. However, the advent of the COVID-19 between, especially during the lockdown period around 2020, between 2019 to 2020, I discovered that Africa particularly was a dark hole, in the sense that there were no accurate clinical records to be captured. And that's where my passion started all along. You would notice that throughout this interview, I've been mentioning data accessibility, because it's a shame that some very basic things like malaria, basic headaches, people cannot be treated on time because there is no data, no relevant data. Even the foreign companies, foreign corporations, NGOs, aid organizations cannot really effectively render the aid that they need to render to Africa. Why? Because they don't even have the data to say this is what Africa needs. These are the equipment, these are the medicines, this is what would actually resolve these issues. And it also prevents us from being able to predict any outbreaks or any pandemics excuse me, that could come up in the future. So having that in mind, I really saw a gap, and I was like, no, I think we need to close this gap. And that's where I started to tilt, not just from tech, not just from software, not just from, all of that, but tilt more towards tech in the health space, to be able to have this data readily available and accessible so that we could save lives across Africa.
Beautiful. So now, I saw a particular post in a particular community that I am, where they estimated the value of quails that God sent to Israelites in the wilderness. And they said if they were to estimate the value of that number of quails, it would take $745 trillion to send that amount of quail to that population of people, to feed them for that period without them lacking, and for them to have that quantity of meat per person. Now, that amount can build 100,000 houses in 7,500 cities in Africa. You can do that math. Now, if you add all the money that you could think of, what health tech infrastructure or solution will you build to make a city smarter for businesses? Now, I say a smart city is basically a city that takes care of its citizens, businesses, and the government, and makes them equal or good stakeholders inside their data and for their own good. So, with regards to that, if you had all the money, all the plain check, right, for you to do anything in a smart city, what will you do with regards to health tech? What? Please tell us.
Okay, so thank you very much. I would say this goes back a little to your question earlier about the gap between the rich and the poor. I mean, people not easily being able to afford some of these tech devices, wearable devices, that would actually aid in healthcare. One very major innovation I would do, or I would implement, there are two actually. The first is building of a central health data repository system. This is very key for health researchers. If I had all the money in the world, I would build that so that health researchers can work on predicting, preventing, and curing illnesses across both, rural and urban areas, cities across the world, not just across Africa, but the world and at large. And this would be in a collaborative effort that would come from a researcher in Africa, a researcher in Asia, a researcher in the US, everywhere, a collaborative ecosystem. I would gladly build that if I had all the money in the world. Now, how do you get this data, those wearable devices? Through consent and, of course, through all the data regulatory systems. NDPR, for example, in Nigeria, HIPAA in the US, and all of that. I mean, I would gladly make these wearable devices readily available for both the rich, the poor, and whoever, because just the same way you are giving an ATM when you open an account, just the way you are giving, some of these ID cards, driver's license and all of that. I would make it that accessible for you to have health trackers. I would make it so subsidized or even free, if possible, to have these health trackers, because they would eventually come to save lives. Having these data readily available, of course, through a regulated data policy. So merging these two innovations, that's what I'll do with the finances in the healthcare space.
Amazing. That's not the end. Do like our page, share this content, let someone hear about this, right? It's super amazing to know that there are many challenges in the health space that are untold or are given very funny names, which could have been solved and not blamed on those who don't know about it. So please do us a favor, right? Reach out to someone, share this content, get to know about how health tech, smart health can help you be involved in your city, in your home, as a citizen, as a business, or as government. My name is Joshua Oshowo, proud host of Bold Faces, an initiative of Smart City Consult. It's a subsidiary of Smart City Mall Africa. Thank you very much for listening, and see you in the next episode.